I see we have people joining us. Well, I'll kick this off and welcome everybody. Good morning. I'm John Casper with the Chamber, and thanks for joining us for this month's edition of our HR briefing. It used to be a breakfast briefing, so it's kind of BYOB, bring your own breakfast. Hopefully this is one of our last Zoom ones, and we'll get into in person again very, very shortly. So with that, we have, as usual, Jim Macy and John Iden with Von Briesen and Roper, and they're joined with another colleague, and I'm having a hard time pronouncing her name. Jim, could you help me out on that?
Nellie Obi is with us this morning as well.
Nellie Obi, so sounds great. Great timely topic as always. CDC changes mask guidance, and again, now what do we do? So we're going to be just reminding everybody we're recording this, and you can go back later and view it. We're pushing it out to the membership. You can, for those that are listening in and participating, you can do a Q&A using the tab on the bottom of your screen, or we're going to make you live. And we're going to invite you all in, and you can have an open discussion at any point. So I think Jim and John and will be monitoring questions that are sent in, and open up for questions at the end. So with that, I'm going to throw it over to Jim, and Jim, take it away from here.
Well, thank you, John, and good morning to everybody. Once again, we have further developments as we go through this really, really interesting employment year, again, with changes to the guidance and things that are out there. And that's what we'll talk about today. Our team, as you all know, our team works a lot on this, monitors things very closely, and certainly have been paying a lot of attention to this. I can tell you, if you have questions about this, you are not alone. Our whole team has been talking to people pretty much all day on the different nuances of what these new developments mean. So our goal today is to help you with that, to clear up. There's a lot of confusion. Let me start with that, to say there's a lot of confusion as to what has come out now. So John and I are going to spend some time talking about what that is. And then we're also going to spend some time talking about what do you do about that? And certainly that's the biggest question that we're getting is now, what are our responsibilities? What can we do? How do we stay safe both in our employment and our business environments, avoid liability, those type of things? As John Casper said, the good news is I think it is another step closer to getting back to breakfast briefings that are important. And not just important, but in person, I should say. They're all important, but in person, and we're really looking forward to doing that again. But in the meantime, we're going to do this Zoom presentation. The one that we have in the PowerPoint, we don't have out yet. It'll be posted with the video of this, so work with us on this. This is the type of topic that, based on the CDC guidance, the EEOC guidance, the OSHA guidance, and all the other pieces that are kind of fitting together with this changes right up until this morning as we're doing this presentation. So bear with us as we keep updating it and we keep working on it, but we'll have it posted as well. With that, let's talk a little bit about the guidance that came out. And if we go to the first slide, John, there's really two major components of what this very recent guidance told us. And for starters, the major first component is that fully vaccinated people don't have to wear a mask. They don't have to physically distance, except, and here's a big exception, except if there is a federal, state, local, tribal, territorial, some local rule or ordinance, some city council ordinance, or if a business decides they want to do something different with that. So last night after work, I drove by Menards, because of course I always got to pick something up on the way home from work. And right away, on the door of Menards was a sign that they don't require masks anymore along the lines of this new guidance. They didn't ask for my verification of my vaccinations, but they left it more to the honor system of under this new guidance. So that was one of the first examples that I saw of that under the new guidance coming forward. The second, we're going to come back and talk about what does this paragraph mean that we just put up on the screen. And then the second piece to this that's the big component of it is that fully vaccinated people can refrain from testing. In other words, what do we do about testing and quarantine and that kind of aspect for fully vaccinated people? Well, they don't necessarily have the same testing requirements or before, and they may not have the same quarantine aspects and isolation aspects as before, again, with certain exceptions to correction and detention facilities. And despite what some of our employees may think of our workplaces, those don't apply in the situations we're talking about today. So with that, John, you want to talk a little bit about that first paragraph and what that means under the guidance?
Yeah, so just to dive a little deeper into the first paragraph, I think that the two biggest exceptions are to the latest CDC guidance is that the ability for local municipalities, cities, governments to pass their own regulations and ordinances. And we've seen since the Supreme Court decision that we presented on, I think last month, we have seen a number of local municipalities, whether counties, cities, villages, pass either guidance, recommendations, or some of them going so far as ordinances. And I think Milwaukee, Madison have ordinances. And we're going to likely see all of those start to come off the books in the coming weeks. But it's important to note that if those have been passed and are still in force, that those trump the CDC guidance. So as an employer, if you're operating in multiple jurisdictions, you're going to want to be aware of what the local area and what the local regulations require. The other key exception to the CDC guidance is that employers and businesses still have the authority to set the safety practices for their premises. So a business, if you're a member of the general public entering a business, you can be required to wear a mask regardless of your vaccination status. The Costco's and the early adopters of the mask requirements back in early 2020, we may see those mask policies linger into the summer months, and that is completely appropriate even with the updated CDC guidance. The same is true for the workplace. You as the employer can dictate the safety practices for your employees, and you can, with legitimate business reasons, distinguish between positions. For example, if you have customer-facing positions versus office positions versus field positions, you have the discretion and the authority to set those policies. So again, the guidance is theoretically based off of the science regarding transmission and infection rates, but the guidance doesn't trump local authority and business authority to dictate what's happening either in their local jurisdiction or on their premises. The second piece of the CDC guidance, or the second benefit, I guess, for vaccinated individuals under the updated guidance is that vaccinated individuals can resume domestic travel and refrain from testing before or after travel or self-quarantine after travel. Now, this component impacts a couple different aspects of the new guidance. Obviously, this is the guidance. If you're traveling to a local municipality or a local jurisdiction that has laws on the books that do require testing before boarding flights or require quarantine, and up until recently, and maybe even today, but I had a friend who traveled to Hawaii, and they had very strict testing protocols, navigating the islands, getting into Hawaii in the first place, and then navigating between islands. So be mindful before you travel that even with the updated guidance, there still may be local rules and regulations that you have to comply with. And from an employer perspective, we're not seeing these policies as much as we did in early 2020, but to the extent that you still have a travel policy as an employer that covers your employees, you're going to want to be mindful of whether or not that is going to be updated to be consistent with CDC guidance, or if you're going to take some other hybrid approach. I know a lot of employers are looking at changing their mask policies, and we're going to talk about that in a little bit. But to the extent that you have other COVID-related policies that deal with travel and quarantine after exposure, this CDC guidance touches on those aspects as well, and those policies can be reviewed and revised as appropriate. So Jim's going to talk a little bit more about kind of quarantine, isolation, and testing, but the CDC guidance is, I mean, to summarize it, eliminated almost all of those protocols for vaccinated individuals. You can, continuing on the travel theme, the CDC has said that vaccinated individuals can refrain from testing before leaving the United States for international travel, unless required by the destination. The same consideration for domestic travel. Where you're going may have rules and regulations that trump CDC guidance and have to be complied with. So again, just know the rules and regulations regarding masking, quarantining, testing, etc. Before you travel. Vaccinated individuals can refrain from testing following a known exposure if they're asymptomatic, and similarly, they can refrain from quarantine following a known exposure if asymptomatic. And they can refrain from routine screening testing if feasible. We saw very little of that in the employment setting. Employers, at least recently, aren't commonly or routinely screening employees for COVID-19, but some venues and some events have taken steps in order to bring people together and put together a production, for example, of tested individuals to make sure that everyone on the premises doesn't have COVID-19. To the extent that you're working with contractors or you yourself as an employer have routine screening and testing policies, again, those are addressed in the updated CDC guidance and can be revised as well. Jim, a little more on isolation, quarantine, and testing.
Sure, and just to follow up on, for those businesses that have people travel on airplanes through airports, the federal law still is, guidance aside, and your policy aside, that masks are going to be required in airports and on planes. This was just talked about again this morning and yesterday, just to clarify from the federal government. So regardless of any rule you may have or decide to free up, that is going to be a requirement for your people that are going to be flying or going through any airport, whether it be any of them was, regardless of what Wisconsin would pass or you would pass, that's still going to apply. But the two major components of the isolation, quarantine, and testing aspect of this for fully vaccinated people is really twofold. It looks at it as, what if somebody that's been fully vaccinated gets the symptoms of COVID-19? And the guidance gives us a little direction under that circumstance, and that's here on the slide, that if they're fully vaccinated and then they get symptoms, they should be evaluated for COVID, tested for COVID, and let their healthcare provider know about those things at the time. What's interesting about that, notice it doesn't automatically require a quarantine or isolation. What it's talking about is saying take the precautionary steps to see what your status is. So let's add a controversial topic right now that's not necessarily talked about in the guidance. And John and I'll come back to some of this as we talk about what policies you may want to do. But there are people that have tested positive for COVID that have then either been vaccinated or not been vaccinated. Several of the scenarios in talking to people within the last couple of days is people evaluating not to get the vaccine because they had COVID and their antibody tests have come back to show that they're higher than if they would have been vaccinated or higher than people with the vaccination. Well, let me at least, and we're going to come back to that piece in just a minute, but for now, if people have been tested, they're going to get some doctor analysis of this, and the doctor's going to say whether it's safe for people to be back in the workplace or back in the other aspects. So there's a suggestion to step back, isolate a little bit, but notice those same time provisions don't apply, okay? The second aspect of that deals with, in the next slide, having to do with people that were fully vaccinated without the symptoms. So we can flip to that, John. With no COVID symptoms, well, they're not going to have some of those initial restrictions, and they're going to be to monitor the situation and to be cautious in aspects of that. But what they're saying is still monitor it for these time periods and other aspects, but notice there's a lot more flexibility to be able to move ahead if there are no symptoms, even with the exposure. This is a big deal because, as all of you know, a major impact of staffing and being in the workplace has been the problem of moving forward with the exposure situations just because there was an exposure. This is a huge exception and a big aspect of thing to step away from some of those pieces. Very, very big. Also big on the earlier slide that I talked about, even with symptoms, it's a fairly big change for those that have been fully vaccinated.
And I think a lot of 2 points to pick up on. One, there is a question on the individuals who've had COVID and feel they don't need to get the vaccine. So we'll flush that out because I think that's an important point. But on the policy perspective, you know, a lot of employers are looking at the mask policy is the one that impacts everyone regardless of exposure, symptoms, COVID-19. I mean, it's you need to wear a mask to be in the facility. So it's front and center for individuals on a daily basis. But most employers likely still have a quarantining protocol in place for their policies and procedures. And I know when we're just looking at a mask policy, and we're going to talk about that, there's a bit of an open question, and Jim and I are going to talk about the pros and cons of requiring proof of vaccination when administering your mask policy. But there is a strong incentive when administering your quarantine policy to ask for that vaccination information, because once you know the vaccinated information, if someone reports an exposure and you say, have you been vaccinated? And they say yes, you can send them back to work and say, monitor your symptoms. Let us know if you're experiencing any symptoms with COVID-19 and we'll reevaluate. But asymptomatic and vaccinated, no quarantine, no testing protocols need to be followed. So keep that in mind. I know most people are probably here thinking about changing mask policies, but this has potential implications on a number of your COVID-related policies and procedures. And if you're going to require employees to disclose vaccination status in one setting, and for example, to avoid a quarantine protocol, but not to be alleviated from the mask requirement, just think about how all those policies interact with one another. But again, to pick up on Jim's point regarding the latest guidance, quarantine and testing disruptions for employees who report exposures, and even those employees who can track COVID-19, those disruptions are eliminated for vaccinated individuals.
Let's talk a little bit about what is not necessarily or still stays as exceptions to some of these rules that John and I are talking about. And John, that's in the next slide. I know you talked about it a little bit earlier as far as that goes, but there are different rules for healthcare settings. So if some of you are in that business, it's going to be different. Lots of confusion a week or, as some of this came out within the K-12 school systems, that's an exception, and they're still under the other protocols, at least for now. As we said, even with these new rules, we still got to know what's going on with the local rules, the city ordinances, the county rules, or city rules. I have some counties that the county has a rule and then the cities within them have a different rule. So depending on where I am in that particular county, I may have a different application. Just yesterday, John and I went through probably a dozen different municipal policies that were coming out within that day, or within the last couple days. They're all a little different nuances of the application of this new guidance as to what that would mean and who has to wear masks and who doesn't. Do you require proof or don't you? And again, we're going to come back to that, but you can't ignore the local rules or the other things that may be going on. And as I'm saying, those are changing immediately. There's a lot of public sector meetings going on now evaluating these local rules. So stay tuned, and we're trying to keep track of that best we can across the state. And of course, it's different for prisons and other aspects, homeless shelters. I've already mentioned that the federal rules regarding travel on commercial transportation, such as planes and trains and other things, are exceptions to what some of these new rules have. John, you want to pick up a little bit on, as I was saying before, and as John's going to pick up on this, the CDC guidance, and let me emphasize the word guidance. It's not the law, it's guidance. But it's also impacted by other agencies. So we can't just look at CDC. We got to look at all the other major agencies to say what's their guidance in regards to this. So John, you want to pick up on OSHA a little bit?
Yeah, and I think a lot of people who follow this stuff closely, this stuff being COVID guidance and agency enforcement and policies and procedures, and if they're listening to presentations or reading articles from people who practice in this space, there's a lot of talk about OSHA enforcement. The expectation was that there's going to be increased enforcement. OSHA, who was fairly silent for much of 2020 after President Biden's election, became much more proactive, released a multi-point set of guidance that mirrored a lot of what everyone had been evaluated and doing previously, but it was more than what OSHA had done to date. And I think a lot of people expected that guidance and those recommendations would be relied upon for subsequent OSHA inspections, where they come in to ask employers, what are your COVID policies and procedures? Because under our general duty clause, you have to provide a safe work environment. And the fear or the concern was that if you're not following the OSHA guidance and recommendations, that they might ding you for failure to follow the general or be compliant with the general duty clause. And in the OSHA guidance, they strongly recommended that all employees be required to wear masks in enclosed spaces, consistent with the old CDC guidance. So we were getting questions before the CDC guidance changed. When can we drop our mask policy? What's happening with the mask policy, especially in light of the Wisconsin Supreme Court decision? And the recommendation had been, not only is CDC still recommended, OSHA is waiting in the wings, and we expect them to be released on employers in full force in the very near future. And then I had released, to illustrate how out of nowhere this was, I had published an article at the Fox Valley SHRM. I sit on the board, published an article, a news update on the Facebook page, indicating that don't do anything to your mask policy for the time being, for the reasons I just articulated. And I expect that in the middle of summer, let's just say around the 4th of July, we'll likely see updated guidance and you'll be able to reevaluate. The next day, the CDC released its guidance, and all the comments in the Facebook posts were, are you stupid or liar? I mean, how did you miss this? I mean, and I feel like I'm not alone. I hope I'm not alone. But so in any event, to get back to my point, OSHA was completely caught off guard, and I believe that the updated CDC guidance is completely inconsistent with the recommendations that they had published and that everyone was expecting enforcement on. So in the wake of the CDC change, the only thing OSHA has done is release the statement that is shown here on this slide, and you'll get copies of the slide. But basically, OSHA says that they were evaluating their guidance in light of the new CDC guidance, and that in the meantime, refer to the CDC guidance for policies and procedures. So they've deferred to the CDC for the meantime, and I'm hopeful that there's some additional guidance regarding administration and application of the CDC guidance, because as we're going to talk about, the EEOC and OSHA haven't come out with detailed instructions or guidance on how to administer a policy consistent with the CDC guidance, which creates a distinction in the workplace between vaccinated and unvaccinated individuals. And I think most HR professionals view that type of policy as a red flag. Now, we have the CDC guidance to support it, justified. It's a legitimate, non-discriminatory reason. But as you get further down this road of distinguishing between employees and monitoring vaccination status, and even for purposes of policing your policy, identifying through some sort of open identification, a different colored name tag, a different colored hairnet, some sort of moniker to show that this person's vaccinated so they don't have to wear a mask, these types of policies start to make employers uncomfortable, and I think for good reason. And I know that a lot of employers and the legal arena as well is looking for additional guidance on where the lines are within the various forms of policy. So back to OSHA, at this point, they've referred to the CDC guidance, a policy that is consistent with the CDC guidance, meaning vaccinated individuals are not required to wear masks, is acceptable under the latest information we have from OSHA, but hopefully there's more coming in the near future.
So in other words, John, what we saw OSHA do is punt. They stepped
Yeah.
said, we're going to follow the guidance, we're going to evaluate it, and we're going to let you know. So what does that mean for everybody online here? If you're in the private sector, OSHA still has the general safety rule, of course, that they could come in and say, are you following the guidance? And before, and I keep using that word saying it's not the law, but the problem is if the agency put out guidance to follow and we don't follow the guidance, then arguably we're not following the safety aspects of things and we could be subject to being fined. In the public sector, again, we may not have OSHA, but the public agency within the state follows the OSHA aspects and they can come in and investigate. And that's separate from workplace grievances to say you're not following the guidance, even though it may not be the law. Bottom line is stay tuned. We'll watch very closely and update you on what OSHA decides. And John, I think you're absolutely right. They were caught off guard, as were some of the other agencies when this guidance just showed up. And they hadn't had a chance to update their thinking and guidance on it because they punted and put this paragraph out as far as that goes. So where all of that puts you is putting together a new policy and different questions you should be asking yourselves as you determine what kind of changes to policy would you make, staying within the guidance, staying within how are you keeping your employees in your workplace safe, first of all, because that's obviously the immediate concern is your customers and employees are healthy and safe, of course. Second of all, avoiding liability aspects. Don't forget the state did pass some protections for us from an immunity standpoint, but it's not bulletproof as far as that goes. So we absolutely have to be sensitive to the liability concerns that we make. Let me put right on the table here before we go into some of the questions you need to ask yourself. Do you pass a policy that sets up a procedure where you ask for vaccination proof? Or do you say, we're going to leave it to people to be honest? Well, John and I are going to come back to that, but it's the primary question we're getting asked every minute since this guidance came out, all right? So hang in there with us on that. Let's look at some of the questions that come together with some of this as you look at that. So can you require non-vaccinated people to wear masks in the workplace? Yes. In fact, quite frankly, under the guidance, it suggests that they have to do that or should be doing that under the guidance. Any other thoughts on that, or you want to pick up on the next one, John, as we go through some of these guys?
Yeah, I think this might be a good spot to address what is considered a vaccinated individual. Now we have the CDC guidance definition of a vaccinated individual. That's someone who's 2 weeks after their second shot of the 2-dose Pfizer or Moderna vaccination, or they're 2 weeks after the single dose shot of Johnson & Johnson. That is the definition of a vaccinated individual for the CDC guidance. Now, there is an opinion among the medical community and certain other aspects of the political community that are advocating for an exception to, or maybe a consideration of individuals who've had who've had COVID-19 to be considered vaccinated or protected for all intents and purposes and for purposes of these policies, because they have the same amount or more antibodies than individuals who are vaccinated and haven't gotten COVID-19. Now, under the CDC guidance, they don't, that category of individuals is not recommended or recognized, not recognized as vaccinated individuals. So under the CDC guidance, vaccinated means those who have obtained a vaccination and are 2 weeks removed from their last shot. Jim, I don't know if you have any thoughts on what, if anything, an employer can do if an employee says, I've had COVID-19, I'm working with my primary care physician. He says, I don't need the vaccination because I have the antibodies and I can get you medical documentation to support that conclusion. Is there any advice or thoughts you have on working in that framework?
Yeah, absolutely. And again, it's unfortunate that this wasn't picked up in the guidance. It's just not addressed. So, but there's quite a bit of science on that. And the guidance always, from the beginning, has said if a doctor weighs in with certain medical opinion, it can trump the guidance. So it would seem to follow that if an employee presented something from their medical provider that says they are safe in the workplace because their testing has demonstrated that they have sufficient antibodies that are as strong or stronger than being vaccinated, that probably from a liability standpoint is protection for the employer to grant or consider that within their policy aspect of things, despite being absent from the guidance. John, I'd be more concerned if guidance specifically addressed it and said this doesn't count, but they didn't say that. They just don't even talk about it. But again, because a medical provider's opinion can trump the guidance, I think that can apply.
And I do think that a medical documentation would have to be an essential component of that exception. I mean, I wouldn't recommend just as an employer saying no masks for everyone who's had COVID and everyone who's been vaccinated. I mean, I think those who have had COVID would have to present some sort of medical documentation to substantiate the conclusion that they're equally protected and safe. So I think Jim's right. They didn't specifically address it and exclude it. So if you have medical documentation, then that's a reasonable basis to go off of. But I wouldn't in your policy simply say, if you've had COVID, you don't have to wear a mask.
If we pick up on the next set of questions, John, it comes into the EEOC guidance and it comes into what degree can we ask medical questions and to what degree are there problems once we get into identifying somebody as vaccinated or not. But what about at least the initial question about asking if somebody can show proof of vaccination?
Yeah, so the EEOC has come out and said that requesting an employee's vaccination status or requesting proof of vaccination is not a prohibited medical inquiry because vaccination status is not a commentary, just that fact alone, yes or no, I am or am not vaccinated, is not a question related to any disability. Now, if someone says no when you ask them why, now you're in more treacherous waters. But simply asking for vaccination status, the EEOC has said that is not a prohibited medical inquiry because, again, that fact alone does not address, comment, or disclose any sort of disability or underlying medical condition or any health information whatsoever other than vaccination. So you can require employees show proof of vaccination. You can ask employees to provide proof of vaccination when administering a policy consistent with the CDC guidance. Now, proof of vaccination, most have seen the vaccination card that you get when you receive the vaccine. That's one thing that the employee can show. They can also obtain documentation from a healthcare provider who administered the vaccine. And I also believe there's a state database that's maintained showing vaccine status that you can request and show proof of vaccination. So those are the different options for form of proof of vaccination. And again, the inquiry and even the requirement, you have to wear a mask unless you provide proof of vaccination. That is an appropriate policy as well. So now the big question, as Jim said, whether or not employers should require proof of vaccination or implement a policy that just says, if you're vaccinated, you don't have to wear a mask and we're operating on the honor system. Jim, what do you think?
So when I went to Menards last night, they didn't ask me when I came in whether I was vaccinated or not. They left that to me, at least as a customer. What I don't know is whether Menards has a different policy for its employees. I noticed that it looked to me like all the employees were still wearing masks, but again, I don't know what their policy was. It's really difficult to say one way or the other which is the best way to do this. And quite frankly, I think it's going to depend on your business, your size, what you and who you have available, and the expertise they have with these things. So let me start with John, at least with the argument of the honor system. If your policy is more general and it just says we're going to follow the guidance, and if you are vaccinated, you don't have to wear masks, and you follow this aspect, and we are going to trust you and our customers in that regard. You also have with that the concept that people need to be honest. And if they're not honest, they're either not welcome in our facility or they're going to be disciplined from an employee standpoint. To the degree that we don't have a big personnel department or the capacity to keep track of all the data with the vaccinations and everything else that goes with that, if we don't have the comfort level of knowing exactly how best to keep track of this medical information, and if we're not in a position to say, okay, we don't have the expertise and the people to know the nuances of having something on a badge versus other disclosures of health information, obviously the policy that's more general, that just follows the guidance, is going to be more helpful to you. Does it fully help you from a liability standpoint? Well, if I'm arguing this policy, I would say that the guidance doesn't suggest anything further. The guidance allows you to have this kind of policy and scenario. We expect people to be honest. People that are not honest are not wearing a mask that should have been are going to be the people that are most susceptible to getting the disease, those not vaccinated. So it doesn't necessarily hopefully hurt those that are vaccinated as far as that goes. From an OSHA standpoint, again, OSHA hasn't given us other guidance as of yet, except to follow that. And again, we are putting out to people that they need to follow the guidance and they need to follow the rules that came out from the CDC. So we protect ourselves from a liability standpoint in that regard. It's simpler, it's less bureaucracy, it avoids some of the issues of dropping the ball on healthcare information and other stuff if we mess that up, and it stays within guidance. That's my pitch, John, at least for that part of the policy. How about you doing the pitch on the other side of things?
Yeah, and I think that to use the OSHA analogy, the employer argues we require safety goggles be worn, we provide safety goggles, and if an employee takes off their safety goggles and gets injured, we've done all we can. We can't control all the employees' behavior. So therefore, our policies are fine. The employees' bad actions are basis for discipline, but we've done our part to provide a safe work environment. Now, the flip side, or the counterpoint, I guess, would be, and again, this to stick with the OSHA analogy, OSHA could come out and say, it isn't enough just to say, these are the rules. You have to take a proactive step to protect other employees. And the proactive step is you have to confirm vaccination status and police and prevent unvaccinated employees from coming to work without a mask. So you can't just say, don't stick your hand in the saw, you're going to get hurt. You have to put a guard on the saw. There's a proactive step that I might be stretching this analogy thin, but there's a proactive step that the employer is required to take to, again, monitor and ensure a safe working environment. And the obvious, quote, risk of someone violating the policy is an unvaccinated individual comes into the workplace and isn't wearing a mask and they have COVID and they're asymptomatic and transmitting, or they're symptomatic and they've told you they're vaccinated, so they're given additional freedoms and they still remain in the workplace, and they spread it to customers, coworkers, or contaminate a product or something to that effect. So that's the concern. Now, I think that this analysis is, to pick up on Jim's point, fact specific in a lot of different ways. The infrastructure and the ability of the employer to monitor and police, gather the information, and then police the administration of the vaccination status and who's wearing a mask and who isn't, versus we're operating on the honor system. But I do think that employers operating in food service and working with high-risk populations who have a lot of contact with the general public and are dealing with food preparation or dealing with, again, high-risk individuals, they may want to evaluate either one, keeping a mask policy in place, or two, ensuring vaccinated status to prevent, again, the risk of an unvaccinated employee coming to work without a mask, because the potential exposure is greater or potentially more harmful in some environments versus others. And finally, on the fact-specific piece of this analysis, a big part of it is going to be your employees and your customers' comfort level with a relaxation of the mask policies. And I think that's environment and population specific as well. Different work environments, different groups of individuals, different industries have, in my experience, different views on this issue. So I think the best practice is for employers to consider or even poll some of the public-facing employees about their comfort level of dropping a mask requirement for everyone that comes into the workplace. Because again, there's an employee morale component to this. Obviously, Jim and I focus primarily on legal requirements and potential risk, but you in the workplace have the best pulse on what your employees' temperature is on this issue. And are they dying to drop the mask and are ready to they'll give you whatever information you want because they don't want to wear those things another day? Or are they pretty concerned still about the prospect of contracting COVID-19 and would be uncomfortable in an environment where everyone isn't wearing masks? Those are, again, additional fact-specific considerations.
So the answer to the question is going to depend on your analysis of all the questions that we're asking in your comfort level and sophistication within your workplace, and comfort level as to whether or not you want a more generic policy that follows the guidance or whether you want a more formal scenario with proof of vaccination and other aspects. John, in talking, there was a question that came in, really a wage and hour kind of aspect to it. And again, we can require vaccinations or not. If we require a vaccination, the question is, to what degree is that compensable time that people go to get the vaccination? And some of our earlier discussion has been is if we require it, and that's an exception, quite frankly, from what we're seeing, but it's okay to do it. You can require it. It may be a compensable situation for the time that we send the people to go do that. And clearly is if we send them during the workday to go do that type of stuff. Any other thoughts on that, John? I know this has come up a couple of times in different presentations you and I have done, but that's still generally the thinking on that.
Right. Yep. Exactly.
If we look at some of the other questions that go with this and other considerations that you may want to consider is, how do you deal with the confidentiality of this? For example, let's say that your policy is going to say, we're going to require proof of vaccination. And those people don't have to wear a mask. So on their badge, they're going to have a sticker that indicates that they've provided essentially that they've been vaccinated and that they don't have to wear a mask. Or it might be just some colored dot, and that dot means they don't have to wear a mask. Well, is that going to be in and of itself disclosure of their vaccination status? To some degree, yes, but notice I didn't say the sticker says I've been vaccinated. The guidance itself allows for the distinction, so it would seem appropriate that that disclosure within a badge that they don't have to wear a mask, notice, is different than I've been vaccinated. So be careful with that minor distinction there. I don't have to wear a mask versus I've been vaccinated is one way to avoid that particular problem. But John, I'm not so sure that designating somebody as vaccinated or not violates the guidance, at least to date. Thoughts on it? But it's coming closer than the other way I'm talking about it.
Yeah, I don't think it does. Again, the EEOC has said vaccination status is not disability related information. So disclosing vaccination status isn't disclosing sensitive medical information and not disclosing any medical information tied to a disability. So I don't think you're in violation of the confidentiality requirements under the ADA, and most employers aren't. Healthcare providers are covered by HIPAA, but regardless, vaccination status, to the extent that that's some sort of protected health information, is being disclosed by the policy itself. I mean, I'm really interested, frankly, I'm really interested to see what EEOC says about the confidentiality piece, about the confidentiality considerations for those employers that are gathering vaccination status confirmations. Because my argument would be the fact that they're not wearing a mask is a disclosure. I mean, there's a question here, what about an employee that's disabled and can't get vaccinated? Well, at this point, under the CDC guidance, if they're not vaccinated, they have to wear a mask. And I don't know, short of an accommodation to a different type of mask, I don't know how an employer could provide an accommodation that removes the mask requirement for an individual who can't get the vaccine due to a disability. And I'm hopeful that the EEOC shines a light on that, or addresses that. But again, under the CDC guidance, vaccination is the only threshold or the only way that an employee can be in an environment, in an enclosed space, without a mask. So again, an employer implements a policy consistent with CDC guidance, you can take a glance around a room and see who's vaccinated and who's not based on who's wearing a mask. Now, to protect against, you can build into the policy to give the employee some control. I mean, I would strongly encourage employers to include language that says, regardless of vaccination status, feel free to continue wearing a mask if that's what makes you feel comfortable. I mean, certainly don't compel anyone to take their mask off just because they're vaccinated. And if someone doesn't want to disclose their vaccination status or doesn't feel comfortable without a mask regardless of vaccination, of course, allow them to continue that, protect them against retaliation or discrimination or harassment from other employees who feel differently. All that should be part of your protocols. But once you've adopted this policy and people start losing the mask, I just think that information is already out there.
And that seems clearly where it's going. We're going to be able to draw those distinctions. It's not going to be a violation. And at least that's what the guidance is telling us to date. And John, your point's well made. Again, we got to stay in tune with what EEOC comes out with and what OSHA comes out with now based on the recent CDC stuff. And we'll let everybody know. But so far, this is where it's heading. And it's moving away from the mass aspects. If you look out publicly, what's going on, and John and I travel all over the state, they're dropping like flies in terms of the mask ordinance policies and the other aspects of that. They're clearly, and this isn't legal, this is the public's appetite, is again, depending on where we are, walking away from the mass aspect of it. I think you got to anticipate that in the employment setting and from a customer setting, that's some of what we're definitely seeing.
Well, and I think if we're reading the tea leaves, and this should be more scientific than political, but unfortunately it's a healthy blend of both. And I think that politically, the federal government wants people to get vaccinated, and they're using this type of guidance as an incentive. Get vaccinated, you have all these additional freedoms. So the EEOC and the agencies that are working in the nuances of these policies, they're not going to put a lot of traps around policing or encouraging vaccinations. They want people to be vaccinated. They want employers to encourage vaccination. They want employers to gather that data and advocate how safe they're being because everyone's vaccinated. That's all part of this initiative and the direction that I think the agencies and the federal government is headed. So I would be shocked if the EEOC guidance came out and created a bunch of high confidentiality thresholds or created a lot of pitfalls around gathering and policing vaccinated status and providing additional incentive for vaccinated employees. I think that's exactly what they're going for.
I think that's exactly right. And it's also why there's this big gap about people that have had COVID have a very high concentration of antibodies, but it's sort of absent because that doesn't fit with the getting vaccinated theme. And again, we're not here to make political statements. We're trying to navigate you through these nuances, but at least put that on the table to say, where is this going? John, I think that's a really smart analysis as to where this is going and what people can anticipate and why we're advising what we're advising through this. Have a policy, consider these different options as to what works best for your workforce, with the primary consideration is how much proof do you want or not. Let's spend a minute on the question about, but all this aside, if we still want to have masks, can we require it? And the employer, the student, or the whoever comes in and says, or the parent, that's my constitutional right by God not to wear a mask. Well, no, that's not the law. That's not the rule. And every local business, and it's real clear in the guidance, still has the right to say, if you are more comfortable simply with staying with this, all the pressures to the contrary aside, we're not saying which way to go. That's up to you. Is you can still require that if you want to for a period of time. Can you still request that customers do that? Sure. You can if you want to do that. Can it be the other way around? Yes, as I said last night, and going, I went in as a customer, no mask, all employees had masks. You know, I've seen that from places to places. So are you restricted by the local rules? Of course you are. That still comes into play as far as all of those things. And will people feel comfortable? Again, it depends on where I go in the state. And John, the same thing as you and I have talked about this. It still varies considerably where I am in the state as to what people's comfort level is with this and what people's degree, quite frankly, of respect is in regards to some of this. I always carry a mask with me. And I was talking about the other day that if I'm in another part of the state and I'm trying to get the temperature of what's going on, I stop at the gas station before I go to the meetings I'm going to go to. And I get a gauge as to who's got what on in the gas station as to what this meeting is going to be like that I'm going to. But out of respect, I'll always have a mask and I'll put that on. I'll clearly follow it if that's the local rule, but in the absence of some of that, just out of respect, I'll do what people are comfortable with in that particular setting.
Well, I think just to reiterate a point I made, and the potential exposure concerns with a change in the policy, the way that the policy is drafted, there's more questions than answers about what's permitted, and where Jim and I are seeing a fairly wide range of choices, particularly with respect to whether to require vaccination and identify employees who are vaccinated, et cetera. But it's important to remember that once this is distributed to the employees and you have some who are wearing a mask and some who aren't, you need to police the conduct of the employees towards one another and make sure that someone who is still wearing a mask, and you may not see it now, but there's going to be a point this year likely where the vast majority of people aren't wearing masks, and there are still people who don't feel comfortable because of a high-risk family member, because of their own disability, because of some other personal reason, and those employees cannot be harassed, discriminated against, or intimidated in the workplace because they're making that choice. And again, that's not where we're at right now, but as you start to see the evolution in the workplace and the mask wearing individuals become a minority in the population, you just want to be mindful of anything, any negative conduct towards those individuals by coworkers, because there may be a protected class status underlying the reason why they're wearing a mask.
Just in monitoring some of the questions, John, that we're getting, first, let me indicate that one of our colleagues works very closely with the EEOC, stays very much up to date on their guidance. This morning was in contact with the EEOC, which hopes to have their guidance out very soon, is the note that our colleague was told this morning. And general thinking, at least right now, is that wearing a mask or not isn't going to be identified by the EEOC as flagging a disability along the lines that John talked about just a minute ago. In terms of some of the other questions, we've talked a little bit about some of these, but in terms of addressing employees who have had COVID and don't believe they need to be vaccinated, that's that group of people we were talking about before there, where there's this gap in the guidance that just is not addressed. And the reality is that somebody who's had COVID may have a much higher antibody count than somebody that was vaccinated. They may be safer in the workplace or out in public than somebody who's been vaccinated. That's a reality that we're hearing from some of the medical profession. That's what we were saying earlier. We don't know yet, but it may be okay within a policy. It's always okay that if the doctor can trump the guidance. If the doctor says we tested this person and they're safer in the workplace than, or as safe or safer than the vaccinated person, that probably can be an exception to the mask aspect. Is there guidance on it? No. Is there the guidance that says specific medical information about returning somebody to work can trump the guidance? Yes, there is. There always has been as far as that goes. So that may be, we just don't have guidance on it, but it would follow that would be appropriate. And can you ask for proof of vaccination while breaking the HIPAA laws? Absolutely, as we talked about before. Yes, you definitely can, and the EEOC guidance has told us you can do that, and it won't violate the HIPAA laws in that regards. And what accommodations do you have to make for an employee that isn't vaccinated or isn't willing to be vaccinated? John, should we spend a minute on that analysis? Again, here's somebody that maybe does not have an opinion that they've had COVID and their antibody count is very high and they're safe. They just don't want to be vaccinated, and they're saying, you let me come to work regardless, whether that's safe or not, because I just don't want to be vaccinated. Thoughts on that? And we certainly had this scenario come up numbers of times. Want to start?
Yeah, the answer is you don't have to, unless someone has a disability as a reason for not getting vaccinated. And even if they have a disability that prevents a vaccination, I don't recommend allowing non-vaccinated individuals, absent the scenario we talked about with COVID, antibodies, medical documentation, just someone who isn't vaccinated. I don't recommend deviating from the guidance and allowing them to come into the workplace unmasked. Now, this goes back to the conversation that we've been having for the last year. What are the potential consequences or exposure if you're not following CDC guidance? And as we've been saying, guidance is just that, guidance. And I'm not aware of anyone I don't have any clients who've had any consequences for failure to follow the CDC guidance, but I've also had most of my clients doing very well at tracking and following the CDC guidance. And again, the concern is that you allow someone who's unvaccinated to come into the workplace without a mask. That's back to everything we've been talking about. The general duty clause under OSHA to provide a safe work environment, the duty under the Safe Place statute to provide a safe work environment. You have someone who you know is not vaccinated, and if you provide them the accommodation of not wearing a mask, then they could potentially bring COVID into the workplace and get other people sick. So there's no legal requirement to accommodate a non-vaccinated individual and allow them to not wear a mask. And I think there's potential legal consequences for deviating from the CDC guidance and allowing that individual to work without a mask.
So the word accommodation applies for those that qualify under the ADA. It's not a general term that just applies to everybody. You have to accommodate them. Somebody that cannot wear a mask might have a medical restriction to that. So then we look at, can we do a reasonable accommodation? As John said, that's not a given. That means, they just get to come into the workplace because they got a medical restriction because of their face or beard or whatever. They can't wear a mask and expose everybody else to a pandemic. Of course not. It's what's a reasonable accommodation. So continuing work at home might be a reasonable accommodation in that setting. Doing other changes within the workplace so they're not exposing others might be a reasonable accommodation. but it still takes that interactive process if they qualify for the ADA as to what's, quote, a reasonable accommodation under the circumstances. We definitely have had people that aren't allowed in the workplace, even with a medical restriction that they can't wear a mask. Again, if there was not a reasonable accommodation for being at work, we've certainly had students in that scenario, that back to school face-to-face teaching and with a medical opinion that they cannot wear a mask doesn't give them a right to be in school. It means they might be schooled in another way, in another manner that's a reasonable accommodation in that regard. So that is not a given, and those are all suggestions, case by case, under reasonable accommodation, using the interactive process. We're just about out of time, John, as far as that goes. I just want to take a quick look in terms of hitting some of the other questions. I think we've covered the different things that are there. If we were to wrap up, it's going to be, you should consider doing a policy. Your options are to do a more generic policy that follows the CDC guidance, keeping in tune with what's coming out from OSHA and the EEOC shortly, within the next week or two, we hope. You can do a more specific policy that's going to require proof. But then again, analyze how you're going to deal with that proof, be sensitive to the confidentiality aspects that go with that. John, Ida, other final comments?
No, I think that's a good summary. And if you do implement a policy, make sure you're tracking updated guidance, because there may be additional information that requires modification. With that, John Casper, we will pass it back to you.
Great, thanks, Jim. John, fast hour. Boy, that's a lot of stuff to take in, and my guess is ever changing, and you need to stay tuned. So again, we thank everyone for joining us. We have recorded this. It'll be online on our website probably later this afternoon, early this afternoon. So go back to it, take a look at it, share it with others. So again, thanks again, Jim and John and Von Briesen for this program and other programs. You've been great partners for us, and we look forward to continuing these. So with that, I will say goodbye to everybody. So thanks again.
Thank you. Bye now.
Thanks.